So statistics are not in our favor, either because you do enough tests, 5%, you're going to pop into that one, or you do a treadmill test or an MRI scan, and you're going to find something that often is meaningless.
Welcome to the Rock Life segment, where we are going to focus on energy and how do we build and make sure we're healthy enough to actually rock retirement. And to help us, as always, is Dr. Bobby Dubois. How you doing, Bobby?
I'm doing well.
Good. Well, I want to make sure, and there's always a disclaimer on this, we're talking about medical topics, and you should always discuss this stuff with your doctor to have or not have screening tests. This is just exploration as to whether you should test or not and how to think about it in an organized way so you and your doctor can make the best decision for you. This is a big topic for me, Bobby, as I've been doing a lot of testing recently. Why is this an important topic in the first place?
Well, I think it's a really important topic because it's becoming more available. You can go online and without your doctor order panels of hundreds of blood tests and arrange to have a whole body MRI scan. And in the past, this was just the purview of you and your doctor together. And now it's much more consumer driven. So because it's so common, and you told and shared with me that you've actually done this, I thought it would be a good idea to talk about whether in fact this is a good idea or whether there's a reason to pause and perhaps not do these broad screening tests in asymptomatic folks.
I think this is a great topic because I've gone down this rabbit hole after reading that book, Outlive. I try to be proactive about my life. I'm 56. I want to be healthy when I'm 70 or 80. And you and I on the show and other places have had discussions about this. And you're right. Wow, I can do all these tests. Why wouldn't I? So I'm excited to explore this because I've gone down this rabbit hole as I've shared some of mine with you. So let's start with, what are the reasons to do the tests?
Well, at the very highest level, they're really compelling. It's like, well, I'll do all these tests and it's like an early warning detector. And if I find something before I'm ill, well, that's got to be good. Finding cancer early, finding heart disease early. It seems like it's a no-brainer rather than waiting and finding it when you're really sick. So at the highest level, it makes perfect sense.
Yeah, I think more information is better. And like when I've seen the journey with my mom and with my sister and other people in my life and in my practice of the discovery of, say, cancer, which is sort of the big one we think about, right? It always seems to be discovered late, and then they just start treating aggressively. So, and just me thinking as I've observed this, is like, well, if we could detect things earlier, it would give us more agency to try to take action. So it seems logical to me that more information would be better. Why might you think twice about this?
And that's the critical question. The positives are pretty clear, and folks just focus on that. And the companies that would like to make some money focus on that. And they don't really give you a full sense of the downside. So I'll give you two answers. One is the kind of very high level answer, and the other is the nerdy example. And given that I'm seriously a nerd, I can't avoid the nerdy answer as well, although I'll try to explain it in plain English if possible. So the CDC has an ongoing task force called the U.S. Preventive Services Task Force, and they come out with recommendations of what type of screening tests folks should do. And in adults, it's really a tiny number. It's pap smears and mammograms and colonoscopies. And then if you're a smoker, the certain type of lung cancer screening. That's it. They don't recommend routine PSA screening, ovarian cancer screening, Grail cancer tests, large blood panels, total body MRI scans, routine treadmill tests for cardiac disease. None of that, they believe, has evidence to support their use. So that's kind of the high level. What do the experts say, or at least one group of experts? Then there's the nerdy explanation. I think it's important to do a little bit of statistics 101 and why screening tests may lead to problems. Okay, so the first thing is kind of the pure statistical way these tests are evaluated. The way most blood tests are determined are you take 100 people or 1,000 people or 10,000 people, and you say, well, the top 5% on this blood test, blood sugar, blood calcium, by definition is abnormal, and you will get a little positive flag. Or the low end of that range, you'll get a flag. And this would be true if we counted freckles on your body. Well, we took 1,000 people who counted freckles. Well, some of you have more than 400. So by definition, that's abnormal or positive. And some of you have 0. Well, that's got to be abnormal too. Or we were counting, hair follicles, in my case, almost none on my, per inch on my head. And you'd say, okay, what's abnormal? So it's a purely statistical determination. And if you do a bunch of tests, you are going to fit into that 5% category in one of them or many of them. So that's the first thing, that you're going to be abnormal if you do enough tests. And then you got to figure out what to do with that.
Whatever happened, can I ask a question real quick? I'm sorry. Whatever happened to personalized medicine when they, decoded the DNA or genes? I forget what it was. They even, the genome, whatever happened to bespoke testing based on, hey, if I happen to have a lot more freckles, that's just me and that's okay. Is that just something that's still happening in the background? I remember everybody was excited about that.
Well, there are algorithms to say, well, your blood test is this and your genetics are that, so therefore worry or don't worry. I think we're in somewhat of the infancy of that. I mean, probably the closest we get is cardiac risk prediction, where, the Framingham Heart Study taught us that age and male gender and smoking and blah, 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 and you come up with a personalized estimate. But for most blood tests, no, you just, get your results and, you have a asterisk or a red color and you run with that.
Okay.
So that's the kind of statistical problem. The other problem in many respects was probably a deeper problem. And this is that tests are not perfect. So if you think about a treadmill test, the exercise study for your heart, there actually is a gold standard. They're not just saying, well, 5% of the top end are abnormal. They actually take 100 people who have heart disease and run them on a treadmill and say, well, do 100% of those people have a positive treadmill result? And the answer is no. You're lucky if it's maybe 75% are positive. Now, that's a problem for another day. We call that sensitivity. So even if you think somebody might have heart disease, the test may be wrong. For today, it's the other side of the coin. Let's say we took 100 people we know don't have heart disease. Maybe they did an angiogram. Maybe we did some other fancy tests. And you run them on a treadmill. What you would like to find is 100% of those people have a normal study. What you find is that you may end up with 20 or 25% of people who we know absolutely don't have heart disease, but they might end up with a positive test. Now, you might say, well, why did we define the test so they would be positive? The problem is if we set it so 0% of normal people are positive, then you're going to miss almost everybody who actually has heart disease. So it's a very complicated process. But the bottom line is you're going to end up with a whole bunch of people who run on the treadmill and they have what looks like a positive result, and lo and behold, they don't. So statistics are not in our favor, either because you do enough tests, 5%, you're going to pop into that one, or you do a treadmill test or an MRI scan and you're going to find something that often is meaningless. So that's the problem. And I'm a poster child. I can tell you a number of scenarios where we went down rabbit holes with my doctor when I had an abnormal test, one of which was a treadmill test. And in my case, it wasn't screening. I was actually having some symptoms. But anyhow, that's, again, a topic for another day.
So when I think of the CDC and their recommended part of it is the scientific evidence, but part of it, I imagine too, is economics, because this is talking about societal protocols that are what the standard is. And when I think of this, I care about that from a societal standpoint. And I think of this with retirement planning too, but ultimately I just care about me, right? And my health. And okay, if that's what they say, what should I be doing if I have the means and the intentionality to do it? That's what I always think of with medicine. A lot of it is about what's the best standard for monitoring health. But another part of it is just societally, what can we afford to do?
Well, I think that's exactly right. I think that's right. And that's why I went to the nerdy example, because that has nothing to do with cost. It totally has to do with you do enough tests, you're going to end up with a positive result. And we're about to get to why is that a problem?
Well, and when we go to, and so before we go there, because this is going to be fun, because you gave me an example that I hadn't thought of when you and I talked privately. Isn't part of finding a negative result, whether it's positive, whether it's an error or not, isn't that a healthy exercise to prompt us to explore it and eliminate it? Even though it happened to be something that wasn't an issue, isn't just that practice of, oh, this looks a little off, let me go check it. That practice seems like that's a healthy thing to do regardless, even though it might send you down a lot of dry holes over time.
Well, we'll get into pursuing dry holes and that it's not risk-free. But let's take an example where you do your blood test and your cholesterol looks great. Well, maybe I don't need to exercise as much as I thought. And, maybe that smoking I was thinking about doing or giving up, I don't really need to. So here's an example where you're falsely reassured that all is well when it's only a tiny piece of a much larger puzzle.
That's a great example. Like I think of financially, I make a lot of income right now and have money in the bank. So you start to get a little lazy in how you spend money. And if you're not paying attention, all of a sudden you're not in that position anymore because things have changed.
Exactly.
So, yeah, I get that. So should we be concerned about false positive tests?
Okay, so let's make the assumption that if you do enough tests, you might end up with a positive result. Now, we have to separate, is that a real positive? You really actually have something abnormal worth knowing about, or is it a false positive? But let's just say you're going to have a bunch of positive tests. Now, let's just say part of your screening test was a PSA for your prostate. And that's not recommended. And it's not just the CDC. Lots and lots of groups have said routine PSA testing, which was considered a thing to do, should not be done. Really? Now, let's say it's positive. And let's say you're 50, 55 years old and it's positive. You're going to end up visiting your friendly urologist in town. And friendly urologist will then examine you, and maybe he'll feel something on your prostate exam, and that might lead to an ultrasound test. And then that could show, well, maybe we better stick some needles in there and do some biopsies, which is really no fun. That biopsy could have complications associated with it, infection, whatever. They may find that, you have a little bit of something going on and you may now buy yourself some surgery and radiation therapy, when in fact, that really isn't a positive result to worry about. The saying goes, if you live long enough as a man, you will die with prostate cancer, not from it. And the problem is differentiating what will never hurt you from what will hurt you is a challenge. And so you may end up down a rabbit hole, which could be problematic.
And making that distinction, Bobby, is, I would think, pretty impossible. Will it, prostate cancer, will it kill me or will it not? Is it something I should act on? It seems like it's just a judgment call. I don't think it's a binary, you can actually figure this out. I don't know.
Well, depending upon what they found, if they actually find do a biopsy of prostate cancer, there are ways to scale that biopsy finding and say whether it's likely to be problematic or not. But as you say, for a lot of people, you'll fall into a gray zone, and then it very much is a judgment call.
So in this example, you can go down getting procedures that 1 will cost money, 2 will cost time, 3 will cost discomfort, and 4 could also cost complications, right? The infection or other things from the procedures. And then probably lastly, well, there's probably a lot more, is mentally, this could be trying as well. The whole time you're worried and you're thinking you're sick and you're going to die, and you start, overthinking a potential problem that might actually be there.
Well, that's right. I think that you can't really avoid the uncertainty and fear while you're going down the path of figuring out, is it a true positive or a false positive? And in some of these cases, you'll get to the end and you'll say, oh, great news. I'm absolutely fine with respect to this abnormality, all the pain and time and worry aside. But let's say you did that routine executive physical and you had your positive treadmill, and then you did another study or another study, and for so many people, you have a little bit of plaque in your cardiac arteries. I mean, almost nobody, they did studies in the Vietnam era where people died at 18 because they were killed in action, and they did autopsies, and lo and behold, they had plaque. Now, was it hurting them at that point? No. But if you do testing and further cardiac testing, almost everybody's going to have some blockage of some sort. Now, you may go to the cardiologist and they'll say, oh, it's nothing to worry about in terms of we don't need to give you a stent or put you on fancy medicines. But you're going to walk out of the cardiologist's office wounded. And you're always going to be thinking, yeah, my cardiologist said it's not a significant blockage, but there is stuff there. And next time I exercise, I'm going to be a little worried not to push it too hard. Or, activity in the bedroom. Maybe I better be a little cautious. And for the rest of your life, you may carry this worry, consciously or subconsciously, that all began because you did some screening tests that were not indicated. And that's really the point of all this, is really to say, there's a positive to all these testing, but there's a downside, and let's understand that before folks rush in.
And that behavioral change of going from exercising regularly and pushing yourself, right, has over time typically had a spiral effect upwards of a health benefit. But mentally, if you say, well, maybe I shouldn't, well, that changes the trajectory of the compounding of habits that could lead to other things later on.
That's exactly right.
That's when that doesn't quite come out when you think about it. That's a wonderful example. Do we want to talk about my test briefly and a few things that sort of demonstrate both of these?
I think that'd be great. Maybe begin by telling people, why did you decide to do it? And then let's explore what we found, you and I, and then, kind of your reflections on what we found.
Yeah. So my intent was to discover where I could know where I'm at and get a normal protocol of testing outside of the doctor that I can actually track, because a lot of times they just send you something and maybe circle one or two things, but I can't see trends easily. So one was I wanted to be more proactive in seeing trends in indicators so I can try to figure out how do I make proactive changes to influence those compounding of things. Maybe I change my diet. Maybe I lower my alcohol consumption. I just wanted to have some agency over my health. That was one. And two was that it's very available and affordable, and I didn't realize that. And then lastly, I wanted to start doing things now that my future self, I'm 56, my 66-year-old or 76-year-old self would be happy that I did, and this earlier you start. So those were my intent. And because it was so affordable and they had these platforms where I could see trends over time, it wasn't the individual test. I thought it was the consistency of doing that was going to be valuable. I just want to be healthy when I'm older and active. So that was my intent.
Again, that makes eminent sense. And then there's the downside.
There are downsides, and you actually pointed a few out. So I used a platform that I found. It's called Function Health. I have no association with it. Bobby has no association with it. We don't recommend, or we don't have any opinion. It's just what I use. So I'm going to share that. And again, as you're thinking about these things, I think it's important to have a guide or a partnership with your doctor as you're making these type of changes, because they are who you should be turning to. We're just trying to flesh out some of the positives and negatives around this testing. So I just want to make sure I reiterate that. Let me share my screen here, Bobby. I got to figure out how to do this because I haven't done this a lot lately. Here we go. Okay, here I am. Here's my dashboard. The first thing I noticed was, hey, I'm 56 and it says my biological age is 47, which makes me feel better about myself. And it tested, it looks like 139 biomarkers. And all of these are quote unquote in range. Of course, what does my eye go to? What do you think, Bobby?
The red numbers of 10 out of the 139. And that just goes to my nerdy example, which is, if you define things as 5% as abnormal on the top and then 5% on the bottom, lo and behold, you're going to have a bunch, and you have 10 that we now have to go down the rabbit hole and say, well, do I worry about this? Do I not worry about this? Uh-oh.
But I don't think of it in a nerdy terms like, wait a second, why are there 10 that are out of range? What's going on there? That's where my mind goes, right?
Of course.
And I don't know where we want to go in this, but obviously on the heart one, which cardiovascular disease is the number one killer by far of everybody, right? Obviously that one's a worry. Do you want to go there first?
We can, or we can go directly to the immunology one, which is where we have the most interesting set of findings.
Let's do that. I think that was this one, right? So this one surprised me, and I think you said it surprised you too. So this is, why don't you navigate this, because you know these words better than I do.
Sure. And for those that are not watching on YouTube, I'll just explain it. So of the 139 that measure all aspects of life, there were 4 that related to immunology, autoimmune disease. This is things like, lupus or rheumatoid arthritis or psoriatic arthritis or psoriasis. There's a whole host of these type of conditions. It turned out for Roger that 2 of them were positive. Rheumatoid arthritis, the rheumatoid factor, and then the anti-nuclear antibody screen was positive, and it had a speckled pattern, which can be associated with lupus. So now Roger has markers that imply there could be a problem immunologically with either rheumatoid arthritis or lupus.
As a layman, Bobby, just so you know, when, spackling and anti-nuclear antibodies, ANA screen, those words are intimidating to somebody who's not a doctor like myself. I'm like, I don't know what that means, but it sounds important.
Absolutely. And if you were now to submit your application for life insurance, where they ask you, every problem known to man, has the doctor ever told you, you're now going to have to answer yes to some of these.
Exactly. Yes, a good point is, this information now, so you have to disclose it when you go down for life insurance.
Exactly.
Or
and you may not
care insurance application.
All of those kinds of things. And you may get denied because of this. And all because it seemed like a good idea at the time to do these testing. Okay, so
from a retirement planning standpoint, I just want to put an exclamation point on that. That's a big one. If you do these tests and this information, that's another downstream practical implication of knowing this stuff.
Absolutely. Okay, so now what do you do with this information? You might talk to Dr. Bobby, and he might say, well, look, you're going to have positive results. Here's some positive results. Go talk to your doctor, but I personally wouldn't worry about it. But let's just say serendipitously you were having aches and pains, or you were having fatigue, and, pick your number, but a huge percentage of all people in the United States of our age group have some aches and pains, and maybe are a little more tired than they were when they were 25. Surprise.
I think everybody.
That would be everybody. I was not going to say that, but that's a reality. And so you now go to your doctor, and let's just say you had been complaining of these problems, and then the doctor finds these, and all of a sudden now, 2 + 2 = 4. Okay, let's maybe treat you for one of these conditions. Now, of course, the doctor might talk to you, get a little bit more information and say, nah, these are false positives, don't worry about them. But you might also have a doctor who then connects the dots and says, oh, let's start you on some of these therapies, which have their own toxicities and problems and fear of, oh, I have rheumatoid arthritis and my grandmother had it and she was crippled from it. So you go down this worry path. So again, this is ultimately a false finding probably for you. Now you got to deal with the consequences of it.
And let's bring back that spiraling example of, because I'm a very active person. You and I are going on a rucking adventure. I row, I do lots of things, and I have lots of aches and pains pretty much all the time. Psychologically, I'm in a place where I am comfortable seeing these kind of results and have some perspective and that I feel like are healthy, right? It's not changing my habits and not changing the internal story in my head about myself. But it's very easy to see these and say, oh, that's why I have these aches and pains. Like your example, maybe I shouldn't stop doing these things, rowing or rucking or whatever it is you enjoy doing, because I have rheumatoid arthritis, or I might. And so you change those behaviors, which have downstream health impacts that likely aren't that healthy if you slow down your activity. Maybe I just sit on the couch for another hour because I don't want to aggravate my arthritis that's not really diagnosed. There's a lot of downstream impacts to these things I can see that can happen depending on who you are.
Absolutely. And I went down this discussion topic with another one of the RRC members, and there were abnormalities. And he was in the frame of mind that it wasn't going to bother him one way or the other. He's very analytic, understands false positives, and it wasn't going to eat him alive. But there's a reason why we describe, the worried well. And the first word of that is worried. And some people tend to worry about health issues. And with false positives, that's fertile territory for worry and anxiety. And
worried well, I like that phrase. That is, I think of that even in financial retirement. They're well financially, but they're still worried all the time. I see that all the time.
Exactly.
So I think we gave a lot of perspective to some of the dangers of over-testing or testing, but there's still a lot of positives. At the end of the day, how might we go about this productively?
Well, I don't want to be a complete nihilist. One of the topics we were going to explore, I might as well just pop into now, which is, are there any tests that I do like? Absolutely. If you following the general guidelines of the screening tests that the U.S. Preventive Services Task Force, you need to get your colonoscopy. You need to get lung cancer screening if you've been a smoker. You need to get your pap smear and mammogram. You should get your eyes checked and your glaucoma pressures in your eyes. I mean, there's some things that absolutely make sense. I also love wearables, not just because I'm a walking laboratory, but I think because the wearables, like your heart rate monitor, or your sleep monitor, or your continuous glucose monitor, or a blood pressure monitor, by and large, for things like sleep and heart rate, there is no absolute, my heart rate's this, that's good or bad. They're just ways of understanding. Oh, I had a lot of caffeine and my sleep monitor says that didn't look good. So it's not this issue of positive or negative. It's something that's very, very actionable. So when I think about testing, I ask myself the following questions. Now I'm more cautious about doing screening tests, but when if somebody comes in with back pain, I apply the same kind of rationale. First, is there a reasonable likelihood that the test is going to show something? And if it did show something, would I do something differently? If I'm going to recommend exercise and a good diet, regardless, then the test really isn't going to change much of anything. And, if the test showed something and I did something unique, would it change the patient's outcome? I try to keep that in mind with all of that, and the beauty of some of the wearables, which are not screening tests per se, but they're highly actionable to what I do in my daily life.
And so, and I've been down this road, and it's really connecting the dots. Oh, I ate those chips at 10 p.m. and this is what my sleep looked like. Or I had alcohol. It's much more actionable. It's the basics, the blocking and tackling of how we live our life without going down the screening rabbit hole. So what's the big message you want everybody to take home?
Well, the first is I may be a doctor. I may play one on TV, but I'm not your doctor. Whatever decisions you make regarding screening and such, speak to your doctor and help get some guidance. So that's why the direct to consumer stuff, which cuts out the doctor, has its challenges. Outside of a small number of the highly recommended routine screening, there's both an upside to doing all of these tests, and hopefully now people understand that there's a downside as well. And I am not against screening. I'm not against testing if you have symptoms. By God, if you have something really going on, that's what we as doctors do. We do tests and we recommend treatments. So I'm not against testing. It's the routine testing in somebody who doesn't have symptoms that has an upside, and now hopefully people have a greater appreciation of the potential downsides. Not that you should not do this, but buyer beware, and know that you may or you will likely have positive results that you'll have to figure out what to do with.
And the whole intent here is for us to build our energy so we can rock retirement
And live long and well.